It's showtime. That's how we begin every day in our office. And I've done that for over 40 years since I worked with Dr. Myron Finkel, a restorative dentist on the Upper East Side back in 1980. It's when I first met Myron. And Myron was an excellent dentist who practiced in a townhouse. And I met him when I was only 27 years of age. And he hurt himself in a car accident and ended up working in his office for 6 months as he was rehabilitating. And every day when we went to his office, he would say to me, Michael, there is no time for personal problems. It's all about the patient. Patient doesn't want to hear about you unless it's in relationship to them. So when we come to the office, it's showtime. And every day we'd start the day like this. He goes, Mike, showtime. And coincidentally, on the Upper East Side of Manhattan, we saw a lot of people in the show business. There were Broadway people coming in and models and a lot of people who were popular in New York at that time. So it was a pretty cool practice for me to work, especially as a 27-year-old. And every day he would say to me the same thing. And today, every day, it's over 42 years later, when I go to the office, I think about Myron Finkel and I say to myself, it's showtime. I added one thing, let me be the gift, but I still think about showtime. And I wrote about it in my book, Treating People, Not Patients, which I'm sure a lot of you have read. The first chapter is called Showtime. So what is showtime? Showtime is giving a meticulously crafted experience for patients. Everything that we do is crafted for their experience, right down from the way the office looks, from the way we answer our phones, the way our website is, for the people we hire, how clean and how neat we are. We all wear the same uniform. We have a dress code. We have a code of hygiene. We have to shower every day before we get to work. We can't have dandruff. Our fingernails need to be cut. They have to be clean. Our clothes have to be ironed. And of course, we have to wear white sneakers. It's a show. Everybody looks good. And there's no difference between the administrative team, the clinical team. We all look the same because we're all on the same team. We don't have people dressed up in dresses or, in what do they call it? Business casual because they're collecting money. No, they just have scrubs on. The doctors don't come in white coats. We don't do that unless we're chilly. We come in our scrubs. So everybody looks the same because it's very, very meticulously coordinated show. And patients sort of get that because they end up trusting everybody because we're all part of the same team. And we don't talk about personal problems. Now, occasionally, I'll hear somebody talk about personal problems in a hallway, and I'll give a look to one of my assistants. I go, could you? And they'll go out and they'll say, hey, could you not talk about that? We can hear that. Because we want everything in our practice to be directed toward giving the best possible experience to the patient. And we want to make it as easy as possible for that patient to go through treatment. Because you know, as well as I know, that one of the most difficult places to be for anybody in the entire earth is a dental practice. I frequently say to my patients that are divorce lawyers, and for some reason I have a lot of divorce lawyers as patients, I said it must be the stress of going through divorce leads to periodontal disease, but I say to these divorce lawyers, I said, you see patients just like I do. They go, how do you mean? I go, you see them at their worst. They are fearful. They don't know what it's going to cost financially. They don't know what they're going to lose. They're completely vulnerable. And I said, you have to do everything possible to make them comfortable. And one of the characteristics I've noticed about my divorce attorneys is I like them. They're all really nice, at least the ones I treat, and they make me feel very comfortable because that's who they are as people. And so they're probably very well skilled and well suited to doing divorce work because they make their clients feel comfortable. Not all dentists do that. Not all doctors do that. And I've had many experiences on both sides, both as a professional and both as a patient. And as a patient, I don't always get a great experience. Sometimes I do, sometimes I don't. Most of the time, I don't. This past weekend, I had to make a phone call for my daughter to try to get her into a doctor's office. It was 18 minutes before they told me they couldn't see her. And that was after giving all the financial information and insurance information. And it was just a terrible experience. But I went through it because I wanted to see how bad really is this. And I was in New York City where I didn't have a connection in that field. So I was just like everybody else. And that's how everybody else usually feels. They feel less than. They don't feel special. In our practice, we want to make everybody feel special. And if you do that, you have a niche that nobody else has. If you make patients feel like they're the only person in the world, which I didn't always do. Early in my career, I was too fast. I was too quick. I'd be talking to the patient. I'd be out the room still talking before I ended anything. Today, we try to make everybody feel special, and we realize what they're going through, because it's very special for a patient to go through treatment in our office. I don't want to go through treatment in a dental office. My patients don't want to be there. But if you give them a great experience, they'll say things like, this is the best experience I've ever had in the medical practice. I feel like I'm in a spa. Thank you so much. Thank you for listening. And every day, we have an opportunity to take it to another level. And I think that's a real privilege. So next time you're in your practice, try to look at the practice from the patient's point of view. Sit in your reception area. Sit back, look around, and say, what would it feel like to be a patient here? And next time you're a patient in somebody else's office, go in not as Dr. So-and-so or somebody with special privileges. Just go in there as a regular person and see what the experience is like. Most of the time, it's not really good. And when you do get a great experience, you go, wow, that was terrific. And you'll tell everybody about it. Isn't that what you want in your own practices? Isn't that what you want for everybody to send patients to you? Not because you're the best at cutting a tooth or doing Invisalign, but because you're the best at making them feel heard, seen. You show up on time, you tell them what you're going to do, and you actually do it, and you do a better job. That's a wow experience. So, hopefully this was helpful. I think about it every day in my life when I go in there, and I feel it's a privilege to be able to do what I get to do. Thank you so much. And remember, be the gift. It's showtime.